More than 45 million adults are taking a statin medication. If statins are so effective for preventing heart disease, heart attacks, and strokes, why is heart disease still the #1 killer of men and women in the U.S.? Have we been lied to? Here's where it gets dangerous. More than 45 million adults are taking a statin medication, which is considered the gold standard for lowering cholesterol and preventing heart attacks and strokes. In this video, we're diving deep into the world of statins to uncover the truth. You'll discover the fascinating history behind these drugs and the groundbreaking research that reveals their strengths and their shortcomings. But it doesn't stop there. We'll also expose the often overlooked side effects, including how statins can damage your nerves, your brain, and even your heart. And here's something you won't hear from your doctor. Statins can deplete your body of many critical nutrients necessary for vital organ function. But don't worry, we won't leave you hanging because we'll arm you with safe, proven alternatives to help you manage your cholesterol levels without the unwanted side effects of statins. Stay tuned as we separate fact from fiction. Coming up. Hey, health warriors, Dr. M here. Today we're tackling a controversial and grossly misunderstood topic, using statin drugs to lower cholesterol. Now, the reason I feel this topic is vital for our Neuphoria tribe is that it's a well-known fact that statin drugs are linked with causing nerve damage. But we've been told these drugs save millions of lives by preventing heart attacks and strokes, and that's certainly important. So I'll help you look at the objective evidence from numerous research studies so that you can decide for yourself if this drug is right for you. Let's start by looking at how a statin is prescribed. If you've been diagnosed with high cholesterol, then your doctor will prescribe a statin medication for you. Believe it or not, there are thousands of people who never wanted to take a statin because they heard about all of the side effects, yet they still ended up on the medication. When I asked them how that happened, the answer I received most often was, "My doctor told me I would die if I didn't take it." I've heard so many patients tell me how doctors have bullied them into various medications or even threatened to drop their care if they didn't take their recommended prescription. It's always our mission to help you navigate the jungle of misinformation from the media, pharmaceutical companies, and even well-intentioned doctors about health, disease, and medications, especially as it pertains to your nervous system. And health warriors, today's topic is one of those insidious jungles. There seem to be two base camps on statin drugs. Camp statin is all about how these cholesterol-lowering medications will save your life. And camp anti-statin is all about how these meds are destroying your health. So which is it? Well, to figure that out, we need to first look at how statins evolved. There were two pharmaceutical companies in a race to be the first to put a statin drug on the market because they both knew how insanely profitable this drug would be. Sankyo, a Japanese pharmaceutical company, was the first to begin researching and testing lovastatin in 1980. Shortly after, Merck, a U.S. pharmaceutical company, followed suit. But a mere 6 months into clinical trials, Sankyo suddenly pulled out of the race and dropped the drug because more than half of their test subjects developed intestinal lymphoma, which is a cancer of the small intestine. And Sankyo deemed this drug to be too dangerous. Merck also followed suit and pulled the plug on their initial research, but later they came back and stated that Sankyo was incorrect about their findings. Merck then pushed ahead with their clinical studies and in 1987 received FDA approval to release lovastatin. But here's what the FDA didn't know at the time. Merck had altered laboratory findings and graphs that revealed permanent damages the statin had caused to test subjects. Because this cholesterol-lowering drug was a cash cow for Merck, in 1997, a different pharmaceutical company named Bayer jumped on the bandwagon and released another statin named Baycol. Cerevastatin is a generic name in the U.S., and in Europe, it was marketed under the name Lipobay. However, in 2001, Bayer voluntarily withdrew this drug from the market in the US, Europe, and Japan because of devastating side effects, especially one known as rhabdomyolysis. This is a disorder where both skeletal muscles and smooth muscles, which are your organ muscles, break down, leading to organ failure and death. This particular drug caused so much harm that Bayer Pharmaceutical Company paid out billions of dollars to settle thousands of lawsuits. Now, here's where it gets really interesting. You might be thinking, okay, since 1997, they've worked out these so-called bugs out of statins, and now they're completely safe. Well, research reveals that all of the current statins on the market have been shown to cause rhabdomyolysis. So this clearly wasn't just a few isolated incidences from a new drug. And when the FDA was questioned about this, their response was, "We've allowed other statins to remain on the market because they haven't resulted in death." I promise you, I'm not making this up. I'll provide you with links to this information published in the British Medical Journal down below so that you can see for yourself. It's important to understand that the history of statins is marred with controversial research practices. For example, in a large trial for simvastatin, researchers used what's called a run-in period. This means that before the trial began, all participants received the active treatment or the simvastatin drug. Those who experienced side effects were excluded from the actual trial. The sole purpose of that is to skew the results, making the statin appear more effective and safer than it is. Now, let's look at one of the most well-known and cited studies on the benefits of statins. It's called the Jupiter study. This is a study that all pharmaceutical companies and most doctors point to prove how safe and effective statins are. But what most doctors don't realize, and certainly the public doesn't realize this either, is that this study was significantly flawed. So let's examine what made it flawed and honestly fraudulent. First, the study excluded people with high cholesterol and cardiovascular disease. Let me repeat this. A study that is trying to prove how effective their drug is for treating cholesterol and heart disease actually excluded participants with elevated cholesterol and heart disease. Second, there was a huge conflict of interest. The trial was funded by AstraZeneca, the maker of Crestor, the statin that was actually being evaluated in this study. Plus, many study authors had financial ties to pharmaceutical companies. Third, the trial was prematurely stopped after only 1.9 years instead of the planned 4 years, preventing the identification of long-term statin side effects. And lastly, there was an underreporting of side effects from the statin, such as diabetes risk, muscle pain, and nerve damage. Now, the Jupiter study was only 1 out of 11 studies that were analyzed for validity and objectivity by unbiased medical researchers. So let's look at what these researchers found in the 10 other studies. They analyzed a comprehensive review of medical data from over 90,000 subjects with a history of heart attacks, and their findings were published in the British Medical Journal. Now, get ready for a side note here, gang. The conclusion the medical researchers reached was that taking a statin drug increased a person's lifespan by an average of only 4.1 days. And for those with no history of heart disease or heart attacks, their lifespan only increased by 3.2 days. So after reviewing all 11 studies, scientists concluded that among people with elevated cholesterol levels, only 2 out of 100 might experience a non-fatal heart attack, where the heart attack actually doesn't result in death. And for those taking a statin drug, there was just a mere 1% decrease in their risk of having a heart attack. Let me repeat that, health warriors. That's only a 1% reduction in the risk of a heart attack when you take a statin. So the ultimate conclusion published by these medical researchers was that for people between the ages of 50 and 75 years old, there is no significant mortality benefit from taking statins. So what the researchers are saying is that statins are not saving lives. There are a lot of people who don't seem to mind that taking a statin only decreases their risk of heart attack by a mere 1%. They mistakenly believe that they're still receiving substantial protection from the drug, when in reality, they're not. This misconception often results in them ignoring the side effects and taking the statin, especially since their health insurance covers the cost anyway. But before you make that decision, I want to share some of the adverse effects of statins that have been published in many research papers, as well as the FDA Science Forum and the World Health Organization. Adverse effects of statins. Statins decrease both HDL and LDL cholesterol levels to abnormally low levels, which ironically increases your risk for heart disease, strokes, and heart attacks. Statins cause cognitive impairment, memory loss, confusion, and amnesia. They're also linked with causing dementia and Alzheimer's, and part of this is because statins like atorvastatin, rosuvastatin, simvastatin, fluvastatin, and pravastatin can cross the blood-brain barrier. Statins cause significant nerve damage leading to peripheral neuropathy. In fact, researchers who studied 500,000 people in Denmark found that after taking a statin drug for 1 year, the risk of developing nerve damage increased by 15%. And for people taking statins 2 years or longer, well, they had a 26% increased risk of developing peripheral neuropathy. This research further revealed that people who already had peripheral neuropathy developed more nerve damage with worsened symptoms after going on a statin. Another adverse effect is that statins cause muscle pain and muscle weakness, which can lead to rhabdomyolysis, a deadly breakdown of muscle tissue. Dr. Beatrice Golem, medical professor and researcher at the University of San Diego, California, conducted a series of studies on statin side effects, and in particular, rhabdomyolysis. She and her team found that 98% of patients taking Lipitor and over 33% of people taking Mevacor, a low-dose statin, suffered from rhabdomyolysis or muscle injury. Statins can also cause fatigue, resulting in difficulty with raising a person's arms above their head or even lifting light objects. And people can also experience difficulty with climbing stairs or getting up from a chair. There's also a tremendous risk of developing diabetes from statin use for both men and women. The risk for men developing diabetes elevates to 45% when they take a statin, while the Women's Health Initiative study found that women taking statins had a 71% increased risk of developing diabetes. There are still more adverse effects reported on statins. They've been linked with heart failure due to the depletion of CoQ10, and they've also been linked with liver failure. They're linked with osteoporosis because they cause bone density loss. And because statins decrease sex hormones like testosterone, they lead to erectile dysfunction, testicular atrophy, and gynecomastia, or what's referred to as man boobs. Statins have also been tied to liver cancer, depression, mood disorders, and sleep disorders. So let me help you process all of this. There's no refuting that statins are extremely effective at lowering LDL cholesterol. However, there's substantial research showing that elevated LDL isn't the real problem when it comes to heart attacks or strokes. In fact, there's a growing body of research that shows that people with low LDL levels run the highest risk of suffering a fatal heart attack or stroke. This is the leading research out now, so don't expect your doctor to be familiar with it. Remember, the average doctor is only aware of the research they're being spoon-fed by the pharmaceutical companies. I'll put the link for the study below. Understanding cholesterol can be confusing, so I want to take a moment to help you fully understand the important role that LDL plays in your body. Now, imagine your bloodstream is a bustling highway system with transport trucks traveling down it, like LDL. Your liver is the main distribution center that sends these delivery trucks, your LDL molecules, to transport essential supplies like cholesterol and triglycerides to various body parts. Cholesterol and triglycerides are a key component for repairing and regenerating cell membranes, including nerve cells. In fact, cholesterol is vital for the regeneration of new nerve fibers. Cholesterol and triglycerides are also the backbone for forming hormones like estrogen, progesterone, testosterone, and cortisol, and it's a critical part of making vitamin D. So your LDL is like a large padded delivery truck carrying large packages of cholesterol to different body areas. It travels smoothly and efficiently along these highways without causing any traffic jams or accidents. Because your LDL is padded, it doesn't easily get stuck in narrow streets, which would be analogous to your arteries. But there's a smaller, more dangerous delivery truck called your SD-LDL. This delivery truck is always overloaded with cargo, making it very unstable. It has no padding on the sides and drives recklessly down highways or streets, causing a ton of road damage. So this would be damage analogous to your arteries. Your SD-LDL delivery trucks are constantly looking for shortcuts where they can slip into narrow alleys. But because these delivery trucks have no padding, they can cause damage to the walls of these alleys or your blood vessels. And they can get stuck in these narrow alleyways, which would be your artery walls, resulting in heart attacks and strokes. So now do you see that LDL isn't the bad guy? Your body actually needs LDL for proper cell membrane function. It's SD-LDL that's the true culprit in cardiovascular disease. But here's the problem. Most doctors never test for SD-LDLs. They only test for LDLs. And when it's elevated, they often come to the incorrect conclusion that you're at high risk for heart disease, heart attacks, or strokes. So let me help you be smarter than your doctor. I'm going to show you how to understand your lipid panel. If your doctor only looks at your total cholesterol, HDL, LDL, and triglycerides and concludes your cholesterol is high, that doesn't automatically mean your SD-LDL is high. It's quite possible to have elevated LDL with a low SD-LDL, in which case you have no risk. If your doctor hasn't run the SD-LDL test, here's how you can predict if yours is low in spite of elevated cholesterol. If your total cholesterol and LDL levels are elevated, but your HDL and triglycerides are within the normal healthy range, then it's far less likely that your SD-LDL, the dangerous cholesterol, will be high, meaning you're less likely to be at risk for heart disease, heart attacks, strokes. Gang, it's imperative for you to know how to look at your cholesterol numbers on your labs for your own protection because most doctors are running old, outdated lipid profiles. The only doctors that are truly up to date on this information are doctors who practice functional medicine, and unfortunately, that's a small percentage. Now, you might be wondering what role HDL cholesterol plays. HDL cholesterol is referred to as your good cholesterol. It functions like the cleanup crew in your arteries. Its job is to patrol your city streets or your bloodstream and pick up excess SD-LDL cholesterol from the tissues and the artery walls before it does damage and transport it back to the liver, where the liver will then recycle it for future use or dispose of it through your feces. Now, okay, here's where it gets dangerous. So many statin side effects get overlooked because when patients tell their doctor that they're experiencing muscle weakness, poor memory, and nerve damage, their doctor will say things like, well, it's because you're old and it runs in your family, and it simply gets dismissed, when in fact, it's often the statin that's causing these symptoms. Now, here's one thing that's imperative for you to understand. If you're not taking a statin, and you make a full recovery from peripheral neuropathy, which is completely doable, and after recovering, you go on a statin, your neuropathy will come back. No ifs, ands, or buts about it. I can't tell you how many times we've seen this in our patients. Now, I want you to have a full understanding as to why these adverse effects occur. Statins are notorious for depleting many critical nutrients your body needs. And it's important that you're aware of this because you'll need to add these nutrients into your diet or take supplements to replenish them. The first nutrient depletion is coenzyme Q10. CoQ10 depletion has become a bigger problem as the pharmaceutical industry encourages doctors to continue lowering cholesterol levels in their patients in greater and greater amounts. This coenzyme, an antioxidant, is essential for energy production and mitochondrial function in the heart, the brain, the nerves, and skeletal muscles. All of these systems, especially the heart and the nervous systems, rely heavily on CoQ10. And there's irrefutable scientific evidence that statins cause your CoQ10 levels to plummet. In fact, a prominent cardiologist, Peter Langston, studied 20 patients with normal healthy heart function. After 6 months of taking 20 milligrams of Lipitor, which is considered a low dose, 2/3 of these patients developed significant abnormalities with the heart's ability to relax expand, and receive blood from the lungs and other systems. This abnormality was linked directly to the depletion of CoQ10. Dr. Langston stated that statin-induced CoQ10 depletion is well documented in many animal and human studies with detrimental cardiac consequences in both animals and human models. He further stated, as physicians, it is our duty to be absolutely certain that we are not inadvertently doing harm to our patients by creating a widespread deficiency of a nutrient critically important for normal heart function. Research shows that statin users should take at least 200 milligrams of CoQ10 daily. Number 2, vitamin B12 methylcobalamin and B9 folate deficiencies. Statins can wipe out these levels, resulting in peripheral nerve damage. Statin users who aren't showing signs of peripheral neuropathy should take 1,000 micrograms of methylcobalamin daily. However, for statin users or anyone that has peripheral neuropathy, we recommend 3,000 micrograms daily of B12, and that's based on research studies. For folate, we recommend between 400 to 800 micrograms taken daily, again, based on the current research studies. Number 3, vitamin D depletion from statins. Vitamin D is essential for both your central nervous system, which is your brain and spinal cord, and your peripheral nervous system. Vitamin D promotes the growth and development of new healthy neurons in the body, most especially in the brain learning centers. But that's not all vitamin D does. It also plays an important role in hormone synthesis, bone health, immune function, pancreatic function, and the synthesis of insulin, which is one of the reasons many people taking statins develop diabetes. Statin users should take at least 5,000 IUs of vitamin D daily based on the research. Now, I'll tell you that this is a very conservative number. For our patients on statins, we start them off at 10,000 IUs and increase this dose until their vitamin D levels reach at least 60 nanograms per milliliter. This is the lowest level I ever want to see of vitamin D in anyone. We aim for keeping our patients' vitamin D levels between 60 to 100 nanograms per milliliter. Number 4 on our list is vitamin K2 depletion from statins. Statins interfere with the synthesis of vitamin K2. Low levels of K2 can lead to increased calcification of the arteries along with decreased bone density. I always recommend a liquid form of vitamin D complex with K2, especially when you're taking higher doses, because the good thing about this is you don't have to calculate the appropriate K2 levels. I'll leave links below to all of the supplements that I'm mentioning today that I use for my patients. Next is number 5, selenium depletion. Selenium is an important trace mineral necessary for thyroid health, brain function, immune system function, healthy sperm, and antioxidant defense. Research shows for statin users, they should take 100 to 200 micrograms per day. Now, the best way to get your selenium in is by eating Brazil nuts. One Brazil nut can contain anywhere from 68 micrograms all the way on up to 90 micrograms of selenium. So you would only need to eat about 3 nuts per day. Okay, on to number 6, acetyl-L-carnitine and L-carnitine. Statins drastically lower L-carnitine levels and its sister compound, acetyl-L-carnitine. Both molecules are crucial for transporting fatty acids to the mitochondria to be converted into usable energy. Acetyl-L-carnitine, however, easily crosses the blood-brain barrier to support brain and peripheral nerve health, and it further protects the nerves from ongoing assault. Reduced levels of either type of carnitine levels can result in cardiovascular damage, mitochondrial damage, nerve dysfunction, muscle pain, and weakness. Studies show that statin users should take between 500 milligrams to 2,000 milligrams of acetyl-L-carnitine or L-carnitine daily. Now, let's look at number 7 on our list, magnesium. Studies have shown that statin medications interfere with the magnesium absorption while increasing the excretion of magnesium out of the body. This means that your body will struggle to absorb any magnesium you're getting through your diet, and it will remove stored magnesium from your tissues. So why do we even care? Well, magnesium is essential for nerve function, muscle function, and energy production for every cell in your body. Low magnesium levels can result in muscle cramps, nerve irritation, damage to the myelin sheath, the protective coating around your nerves, and low magnesium levels can disrupt healthy nerve signal transmissions, leading to tingling, numbness, muscle weakness, muscle tremors, seizures, and even mood changes. Research suggests that statin users should take up to 400 milligrams of magnesium daily. The best form of magnesium is magnesium glycinate. And the last one I'll cover today is omega-3 fatty acid deficiency caused by statins. Statins can disrupt the metabolism of omega-3 fatty acids because they're dependent upon LDL to transport them to the brain, the peripheral nerves, the heart, the eyes, joints, and the immune system, and all cell membranes. Because statins decrease LDLs indiscriminately, this can decrease the ability for omega-3s to make it to vital tissues. Research shows that statin users should take anywhere between 2,000 milligrams to 4,000 milligrams of fish oil containing both EPA and DHA daily. And there you have it, health warriors. All of the science, all of the research, and all of the facts about statins. In today's world, you can no longer afford to take your hands off the steering wheel or your eyes off the road and let your doctor control your health journey without your active participation. It doesn't matter how well-intentioned your doctor may be. Doctors simply aren't staying current with the research. In their defense, it's not an easy task, so they default to allowing their pharmaceutical reps to educate them. Your bad health may not be your fault, but it is your responsibility. It's time to be a co-pilot in your own healthcare. That's why we're giving you all of the tools and objective science you need to properly navigate the rough waters of a failing healthcare system and regain control of your health. In next week's video, we'll educate you on how you can safely and effectively lower your cholesterol levels, and I'm talking about the truly bad cholesterol, SD-LDL. Make sure you click on that bell to get notified of next week's video because it will arm you with the necessary tools to protect your heart health and the health of your nervous system. And if you're enjoying our videos, please don't forget to like and subscribe to our channel. It helps YouTube send our videos out to more watchers. If you have any family members or friends currently on a statin, please make sure to share this video with them. Never forget, your health is a journey. Stay curious, ask questions, and seek out the best path for you. I look forward to seeing you on the road to great nerve health. Blessings. Damage to the myelin sheath. There's substantial research. Dr. Beatrice Gollum, medical professor and researcher at the University of